Topeka, Kansas, and basically without glasses I'm pretty much blind. So I've traveled to Jacksonville to visit Dr. Gulani. As you can see, I've got very thick pop bottle glass type lenses, and without them I am virtually blind. And again, I've had previous RK surgery, and it worked for quite some time, but is simply collapsed, and it's my vision now is to the point where I'm almost debilitated without glasses. So I'm so thankful that there's an opportunity here with Dr. Gulani to perhaps shed these glasses and be free of these Coke bottle lenses and not as debilitated.
Comfortable?
Yes.
You're done with your surgery?
Wow.
Yes?
Wow. I can see you.
Yes.
Am I supposed to be able to see? That's amazing. You're like Moses. Thank you.
Very, very good. Look who's here.
Hey, boys. How's it going?
Scott, can you see a little bit already?
Yeah, I can recognize him. Scott again from Kansas. I shared my story with you yesterday, and after day one, I have popped the Coke bottle lens out of my glass. I no longer need it. I can see very clearly and elegantly with the help of Dr. Gulani at Gulani Vision in his Vision Suite here today. My name is Scott. I traveled from Topeka, Kansas. I am a RK surgery patient that had RK 30 years ago, and the last 15 years my vision has decreased and degenerated to the point where basically all I can do is see silhouettes of people without giant Coke bottle type lenses to wear for glasses. I was under the impression that there wasn't much that can be done for me. I went to other doctors. Finally, I found Dr. Gulani, and day one, after having procedure performed right next door in his Vision Institute, I was able to actually day one after surgery see literally 20/30 for the first time, I think, in my life. So it's been an amazing experience. The people here are so friendly and helpful, and I would recommend this trip to anyone that has had vision problems or thinks that there's just nowhere else to go, or if they think they're from the land of misfit eyes. This is the place for you. Dr. Gulani can help you. The people here will find a way to help you see better.
So here you are?
Doctor, there's nothing like this on earth. I am so pleased with the outcome. I walked in here with basically blind without thick Coke bottle glasses, and I'm walking out of here with 20/20 vision. There's nothing like it on the planet.
Scott, an honor. I've just seen your numbers. It's amazing. They refracted you to 0, which is plano. Your vision's 20/20 despite having +9 hyperopia and -8 astigmatism. This is what I'm actually going to teach today in Miami at a very prestigious meeting with eye surgeons, where I want to share with them that all these things are possible, not to give up.
Well, I was told that I couldn't be helped, and this is proof that there is a doctor that will fight for you, and this is the place to be for that fighter, Dr. Gulani.
Thank you, dear. Have a safe trip back home to Kansas, and keep in touch, and I'll see you for your other eye soon.
Thank you, doctor.
Come on. Surgery is going very well. Any pain? It's super. Any pain at all?
I don't feel anything.
We're all done. We just did your second eye, and you came back after your first eye surgery we had done in the other eye with all your multiple RKs and extreme astigmatism scars. How do you feel?
I feel fantastic. And I look great. I can see you.
Yes?
It's amazing.
Pleasure, Scott.
Thank you so so
So
much.
two things I'm recording this for. One is I always record my cases for surgeons, but also because the suite concept. This is not a, you didn't get any IV, no sedation, no drugs. It's not a hospital environment. It's a very elegant, high technology, but very just with drops.
Soothing.
Right, and even with your kind of complex case, we already did your first eye a couple of weeks ago and you came back from Kansas. So today we've done your second eye. How do you feel? Any pain, any discomfort?
Didn't have any pain, I didn't have any discomfort. It was like I was just laying there, soothing, in a soothing environment, caring, soothing. I knew I was in great hands.
Thank you, Scott, for coming back for your other eye.
Absolutely.
And are you seeing already? A little bit.
Yes, I can't believe I could read that. That's amazing.
Because he was so farsighted with such high astigmatism and RK scars. I expect him to see just because of his refractive error. The fact that even with his cuts and scars, they've not taken a stitch. I use a sealant for his travel. So Scott, very proud of you.
Oh, I'm so happy.
But please protect. I'll see you tomorrow before you travel. Where is he?
Hi, Gina.
Can you see
I
me?
can see you.
Really?
Yes.
Can I kiss you?
Yeah, I think so. You just can't kiss
Twice
me.
a day.
Can you really
Thank
see?
you, Audrey. Yes.
Yay!
It's amazing.
Yay! I'm
incredible, I
so
tell you.
excited.
I am excited. It is great.
Perfect. Lights.
Yeah, so I know. It's amazing.
To me, what is also important is the fact that in the suite concept, he's not in a hospital. And my question, given your complex eye, Scott, we did your first eye weeks ago here when you came down with your sons from Kansas, and today with Gina, your wife, is do you wish you had drugs or medication or anesthesia for your surgery?
No, that was a very soothing, caring environment, and I'm glad there's no tubes or needles or any of those other things that.
As you know, his case is very complex scars with previous radial keratotomy, cuts, complex cataract, and extreme farsighted and extreme astigmatism. But Scott, I think we got it.
Oh, I think you did too.
Get some rest, and I'll see you
Thank you.
tomorrow. Good morning. How are
Good
you?
morning, Dr. Gulani.
Fantastic. So, how do you feel?
I feel great. There's no pain. I'm seeing well, and it's fantastic.
Super. Again, with you, Scott, I'm recording, as you know, all our patients impromptu. You had come in again with extreme RK scars, very high oblique astigmatism, extreme hyperopia +8, and we did your surgery, lens exchange surgery in the suite yesterday. So, most important question that I asked you, which I asked you when I did your right eye
Yes.
a few weeks ago before you went back to Kansas, is any pain during surgery?
Oh, there was no pain whatsoever.
None. Again, remember you had no drugs, no IV, nothing, just
no
numbing.
tubes, no needles, no sticks. It was simply a few eye drops, and I was in a caring, comforting, very comfortable environment full time.
Any pain that you feel today, any discomfort?
No pain or discomfort at all.
Great. Gina, you've been a nurse,
Yes.
and being his wife, you know about his condition
Yes.
and how he was suffering. But what I'm also recording this for is not just his outcome, which I'm already thrilled he's seeing, but also the fact that the suite concept that we have of doing surgery in the surgical suite, not in a surgical hospital, is where I'm recording all our patients from all over the world to see if any of you would have wanted anesthesia, even with your complexity of your case. Did you feel discomfort, pain? How was your experience when you came in yesterday? You had so much experience in the medical field. For your husband, how did you feel coming into this surgical suite?
Oh, he did not have any anxiety. He was just very comfortable. He looked like he was a kid at Christmas time, especially afterwards, a kid at Christmas time. Very excited to be able to see afterwards, and he wasn't groggy or nauseated afterwards. He just went back to the hotel, and I brought him lunch and was able to eat and just rest for the rest of the day.
Super. So I've imaged you here. You can see the lens in position, no stitches, even with your cuts and scars. Scott, very proud of you. Safe travel back to Kansas.
Yes, sir.
Hear from you regarding your follow-up, all right?
Okay, thank you very much,
My
Doctor.
pleasure again. Thank you.